This is Dr. Cotty, and today we are going to talk about substance use disorders. The objectives for this module include to define addiction, intoxication, and withdrawal, to identify symptomatology in clients with various substance-related and addictive disorders, to identify the nursing diagnoses, interventions, and outcome criteria for evaluating clients with substance use disorders, to identify topics for client and family teaching relevant to substance use disorders, and to discuss the issue of substance use disorders within the profession of nursing. So what does the DSM-5 criteria say about substance abuse? Well, it's a recurrent substance use that results in a failure to fulfill major role obligations at work, school, or home. It can also be used in situations in which it is physically hazardous. Recurrent substance-related legal problems, and continued use despite having persistent or recurrent social or interpersonal problems. We need to make sure we know the difference between abuse and dependence. So what does the DSM-5 criteria say about substance dependence? Well, this is physical dependence. So that would include withdrawal. Without the drug, withdrawal symptoms occur. Psychological dependence, so an overwhelming desire to continue using the substance for pleasure and to avoid discomfort. There would be an evidence of tolerance, a need for markedly increasing amounts to have the same effect. Evidence of withdrawal, symptoms associated with the substance and substances taken to relieve the withdrawal symptoms. A persistent desire or unsuccessful effort to cut down or control use. And a great deal of time is spent obtaining the substance, using the substance, and recovering from the effects of it. So now let's review the DSM-5 criteria for substance intoxication and substance withdrawal. Intoxication is a reversible syndrome that it's clinically significant because of maladaptive behaviors or psychological changes that result from the effect of the substance on the CNS, the central nervous system. And this develops during or shortly after the use of the substance. Substance withdrawal is the development of a substance-specific syndrome caused by stopping, so by cessation of, or a reduction in heavy and prolonged substance use. It will cause distress and impairment in social relationships, occupation, and other important areas of functioning. And neither of these can be due to a general medical condition or because of another mental health disorder. We're going to start by talking about central nervous system depressants. These can produce physiological and psychological dependence and may have cross-tolerance, cross-dependency, and an additive effect if you take them together. So for example, smoking weed and drinking alcohol. The way the drugs operate is that they affect the neurotransmitter GABA, and this leads to the side effect like drowsiness, relaxation, decreased inhibition. So in general, central nervous system depressants can be used to treat a number of disorders like insomnia, anxiety, panic attacks, stress, sleep disorders, pain, seizures. And there are three major types: sedatives, hypnotics, and tranquilizers. Alcohol, also known as ethanol, is a central nervous system depressant. A blood alcohol concentration, or BAC, of 0.08% is considered legally intoxicated for adults if driving a car in the US. Death can occur if the level is above 0.35%. Blood alcohol concentration levels depend on many things: body weight, gender, how strong was the alcohol in the drinks, how many drinks did you have, how fast does your GI tract absorb the alcohol, and what's your tolerance level. The intended effects of alcohol are to relax, decrease social anxiety, and stress reduction for many people. But the effects of drinking in excess and being intoxicated include slurred speech, nystagmus, memory impairment, altered judgment, decreased motor skills, decreased level of consciousness, which can even include stupor or coma, respiratory arrest, peripheral collapse, and death from large doses. Chronic use gives us things like cardiovascular damage, liver damage, ranging from fatty liver to cirrhosis. You might have gastrointestinal bleeding, gastritis, acute pancreatitis, and sexual dysfunction. Withdrawal effects start 4 to 12 hours after the last intake of alcohol, and they peak within 24 to 48 hours. Then they go away. Manifestations of withdrawal include abdominal cramps, vomiting, tremors, restlessness, inability to sleep, increase in vitals, so an increased heart rate, blood pressure, respiratory rate, temperature. They can even cause transient hallucinations or illusions, anxiety, and tonic-clonic seizures. Alcohol withdrawal delirium can occur 2 to 3 days after cessation of alcohol and could last 2 to 3 days. It's considered a medical emergency. So we might see severe disorientation, psychotic symptoms like hallucination, severe hypertension, cardiac dysrhythmias, and these symptoms could progress to death. So this is a very serious problem. Let's talk about patterns of use or abuse. So phase 1 is the pre-alcoholic. This person may be drinking daily to relieve everyday stress and tensions of life. The early alcoholic, phase 2, begins with blackouts, brief periods of amnesia that occur during or immediately following a period of drinking. Alcohol is now required by the person. Phase 3 is a crucial phase. The person has lost control and their physiological dependence is clearly evident. Phase 4 is the chronic phase. So we would see emotional and physical dependence, and this person is usually intoxicated more often than they are sober. Alcohol has a lot of negative effects on the body. Peripheral neuropathy. So nerve damage, which causes pain, burning, tingling, and prickly sensations of the extremities. Alcoholic myopathy is thought to result from a B vitamin deficiency, and that helps contribute to the peripheral neuropathy. So in its acute phase, it's the sudden onset of muscle pain, swelling, and weakness. There might be a reddish tinge to the urine and a rapid rise in enzymes in the blood. When it's chronic, it's the gradual wasting and weakness in skeletal muscles. Wernicke's encephalopathy. So this is the most serious form of thiamine deficiency in alcoholic patients. It can cause paralysis of ocular muscles, ataxia, stupor, and we treat it with an IM injection for about 3 days. Korsakoff's psychosis is a syndrome of confusion, loss of recent memory, and confabulation in alcoholic patients. Alcoholic cardiomyopathy. The effect of alcohol in the heart is an accumulation of lipids in the myocardial cells, resulting in enlargement and a weakened condition. Alcohol can also cause inflammation and pain in the esophagus because of the toxic effects of alcohol on the esophageal mucosa and also because of frequent vomiting. Gastritis can be caused by effects of alcohol in the stomach, and that includes inflammation of the stomach lining, characterized by epigastric distress, nausea, vomiting, and distension. Pancreatitis. When pancreatitis is acute, it occurs 1 to 2 days after a binge of excessive alcohol consumption. The symptom is severe, constant epigastric pain, nausea and vomiting, and abdominal distension. When it's chronic, it leads to pancreatic insufficiency and results in malnutrition, weight loss, diabetes mellitus. So a lot of complications from pancreatitis, and it is so painful. Alcoholic hepatitis is caused by long-term heavy alcohol use. So symptoms are an enlarged liver, nausea and vomiting, lethargy, anorexia, fever. You might see weight loss. So again, a lot of signs and symptoms with alcoholic hepatitis. Effects of alcohol in the body can also include cirrhosis of the liver. Cirrhosis is the end stage of alcoholic liver disease, and it's caused by long-term chronic alcohol abuse. The liver eliminates 95% of alcohol from the body. The rest is eliminated through urine, sweat, and breath. There is widespread destruction of liver cells, which the body replaces with scar tissue. Portal hypertension can occur, which is the elevation of blood pressure through the portal circulation, and that results from defective blood flow through this damaged liver. Ascites is when an excessive amount of serous fluid accumulates in the abdominal cavity, and it occurs in response to portal hypertension. You can even have veins in your esophagus become distended because of the excessive pressure from defective blood flow when a liver has cirrhosis. So a lot of really negative effects of alcohol on the body. Sexual dysfunction. So it can enhance libido initially, alcohol can, but failure to obtain an erection is a common problem. With short-term use. In the long term, you could have gynecomastia, which is breast development, sterility, impotence, decreased libido. So use during pregnancy can also cause fetal alcohol syndrome spectrum disorders. The signs and symptoms of this include issues with learning, memory, attention span, communication, vision, hearing. So it can cause birth defects and neurodevelopment disorders. No amount of alcohol during pregnancy is considered safe, and alcohol can damage a fetus at any stage of pregnancy. So again, let's review the characteristics of fetal alcohol syndrome. There'll be sleep and sucking disturbances in infancy. There could be heart and kidney defects, abnormalities in size and shape of brain. They'll be small for their gestational age, could have vision and hearing problems, facial abnormalities. So these would include skin folds at the corner of the eye, a low nasal bridge with a short nose, an indistinct groove between the nose and upper lip, small head circumference, small eye openings, a smaller mid-size in the middle of their face, and a thin upper lip. These individuals can have learning disabilities, hyperactivity, poor reasoning and judgment skills, and they're more at risk for mental health issues. The Clinical Institute Withdrawal Assessment of Alcohol Scale. So here are just some of the things that you would find on that scale. And in addition, you would want to take the patient's vital signs. So nausea and vomiting, tremor, sweating, anxiety, agitation, tactile, auditory, or visual disturbances, headaches, and orientation. Screening tools. So various assessment tools are available. We just talked about the CWA-AR, the Clinical Institute Withdrawal Assessment of Alcohol Scale. We have the Michigan Alcoholism Screening Test, or MAST, and the CAGE questionnaire. Have you ever felt you should cut down on your drinking? Have people annoyed you by criticizing your drinking? Have you ever felt bad or guilty about your drinking? And have you ever had a drink first thing in the morning to steady your nerves? That's known as an eye opener. Nurses also need to screen themselves. So we need to examine our own attitudes and remember that when we have biases towards individuals, we really need to evaluate our culture, our beliefs, our personal relationship with alcohol or drugs, our family's relationship, and look at how we are talking, what our body language is saying, the words that we're using, because we cannot be therapeutic with a patient if we have a negative attitude towards them or what they are going through. So we want to be non-judgmental and have empathy. Pharmacological treatment of alcohol. Thiamine and vitamin B1 are very, very important. So multivitamin therapy is very, very important. Also, benzodiazepines or anticonvulsants help stop seizures during alcohol withdrawal. After the individual has gone through withdrawal, there are medications that are aversion medications, which makes it unpleasant when the individual drinks. And there are other medications that can stop cravings. And we'll talk more about those coming up.
We're going to take a break here and take a stretch. You're doing great. We will do sedatives and hypnotics coming up next.